Hello, everyone. Today we're going to talk about something very simple, very powerful, and often overlooked when it comes to muscle health, especially as we age. If you're dealing with muscle weakness, muscle loss, nighttime cramps, slow recovery, or stiffness in the morning, this is for you. And the best part? You take this before bed when your body does most of its repair work. Let's talk about why nighttime matters for muscle health first. While you sleep, your body releases growth hormone, repairs damaged muscle fibers, reduces inflammation, and rebuilds strength. But for this process to work properly, your muscles need the right nutrients available in your bloodstream. One of the most effective natural options you can take before bed is magnesium-rich foods or magnesium itself, especially from pumpkin seeds, almonds, or magnesium glycinate. When you fall asleep, your body doesn't shut down. It switches into its most powerful repair mode, and most people have no idea this is happening inside them every single night. While the world goes quiet, your muscles begin a deep biological process that science has shown cannot happen fully during the day, no matter how much you exercise or eat. This is the window where your body decides whether you will grow stronger or slowly weaken over time. Research from the Journal of Clinical Endocrinology shows that up to 70% of your daily growth hormone release happens during deep sleep, not during workouts, not during rest, but during the darkest hours of the night. Growth hormone is not just for children. It is the master repair signal for adult muscle tissue, responsible for rebuilding damaged fibers, increasing strength, and preventing age-related muscle loss known as sarcopenia. As you age, this hormone naturally declines, and studies show that poor sleep can reduce it even further by up to 50%, accelerating muscle breakdown silently year after year. During deep sleep, your nervous system shifts from fight or flight into rest and repair. Cortisol, the stress hormone that literally eats away at muscle tissue when elevated, finally drops. Blood flow is redirected from digestion and movement toward tissue repair. This is when amino acids are pulled into muscle cells, damaged fibers are stitched back together, and inflammation is cleared away. Scientists have observed that muscles are actually more sensitive to nutrients at night than during the day, meaning what's available in your bloodstream before bed directly determines how well your body can repair itself. If the right minerals are missing, the repair process stalls. If the nervous system cannot fully relax, muscles stay partially contracted, starving themselves of oxygen and nutrients. This is why so many people wake up stiff, sore, or cramped, because their muscles never truly recovered. Here's the shocking part. Even people who eat healthy diets are often deficient in the very mineral that allows nighttime muscle repair to happen. Magnesium deficiency affects nearly 50% of adults worldwide, according to large population studies, and the risk increases with age, stress, medication use, and exercise. Magnesium is not just a supplement, it is a biological switch. Without it, muscle cells cannot relax after contraction. Calcium tells muscles to contract, but magnesium tells them to release. When magnesium is low, muscles remain in a constant low-grade state of tension, burning energy all night long instead of repairing. This tension disrupts deep sleep stages, lowers growth hormone release, and keeps the nervous system slightly alert when it should be fully calm. Sleep researchers have found that magnesium plays a direct role in increasing slow-wave sleep, the deepest and most restorative phase where muscle repair peaks. In clinical trials, people who increased magnesium intake before bed showed measurable improvements in sleep quality, reduced nighttime awakenings, and lower markers of inflammation by morning. Inflammation is critical here. Chronic low-grade inflammation has been shown to block muscle protein synthesis, meaning even if you exercise and eat protein, your muscles cannot rebuild efficiently. Nighttime is when inflammation is supposed to be cleared, but without proper mineral balance, it lingers, quietly damaging muscle tissue over time. Think about this. Every night you miss quality sleep. Studies show you can lose measurable muscle mass, especially if you are over 40. One landmark study found that just 5 nights of restricted sleep reduced muscle protein synthesis by nearly 18%, even in young, healthy adults. Now imagine what years of poor sleep are doing to muscles in older adults. This is why muscle loss often feels sudden. It's not sudden at all. It's the result of thousands of nights where repair never fully happened. Your body was designed to heal in the dark. Ancient humans slept in alignment with natural light cycles, allowing deep, uninterrupted sleep. Modern life has broken this rhythm with screens, stress, late meals, and nutrient depletion. The result is a body stuck in survival mode at night instead of recovery mode. Muscles never get the signal that it's safe to rebuild. Growth hormone release is blunted. Cortisol stays elevated. The nervous system never fully powers down. But science shows that when you support your body before bed, when you give it the tools it needs, the repair machinery turns back on. Magnesium helps activate GABA, the brain's primary calming neurotransmitter, which slows brain activity and allows deeper sleep stages to emerge. Deeper sleep means more growth hormone. More growth hormone means stronger muscles, faster recovery, and better resilience against aging. This isn't theory. It's been observed repeatedly in sleep labs, muscle biopsy studies, and long-term aging research. Nighttime muscle repair is not optional. It's not a bonus. It's the foundation of strength, mobility, and independence as you age. Without it, muscles shrink, weaken, and fatigue faster, increasing the risk of falls, injuries, and chronic pain. With it, muscles maintain their structure, power, and endurance, even with minimal exercise. The difference between decline and resilience is often decided while you are asleep. The most powerful part is this: your body wants to heal. It is programmed to do so. It has been waiting every night for the right conditions. When you align with that biology, when you respect the nighttime repair window, everything changes. Muscles stop fighting you and start rebuilding for you. Recovery becomes automatic. Strength becomes sustainable. And aging no longer feels like a rapid loss, but a controlled, supported process. This is why what you do before bed matters more than most people realize. It's not about forcing change. It's about removing the barriers that block your body's natural repair systems. When the night finally becomes a time of true rest, your muscles respond the way they were always meant to, silently, powerfully, and relentlessly rebuilding you from the inside out. Magnesium is one of the most powerful minerals in the human body, yet it remains one of the most dangerously ignored, and science is now revealing that this single deficiency may be silently destroying muscle strength, recovery, and longevity in millions of people. Every movement you make, every step you take, every breath you draw depends on magnesium working behind the scenes. Without it, muscles do not behave like muscles anymore. They become tight, weak, inflamed, and exhausted, even if you exercise and eat well. Researchers have confirmed that magnesium is required for more than 300 biochemical reactions, but what is rarely talked about is that muscle tissue is one of the biggest magnesium consumers in the body. When magnesium runs low, muscles are among the first tissues to suffer. At the cellular level, magnesium is the gatekeeper of muscle movement. Calcium triggers muscle contraction, but magnesium is the signal that tells muscles to relax. This balance is not optional, it is life critical. When magnesium levels drop, muscles remain partially contracted even at rest, burning energy, producing waste, and accumulating tension. This is why magnesium deficiency is strongly linked to muscle cramps, spasms, twitching, stiffness, and chronic soreness. Studies published in the American Journal of Clinical Nutrition show that low magnesium status increases muscle excitability, meaning muscles fire when they shouldn't, leading to pain and fatigue that seem to come out of nowhere. What makes this truly alarming is how widespread magnesium deficiency has become. Large population studies estimate that nearly half of adults fail to meet the minimum daily magnesium requirement, and some researchers believe the true number is even higher. Modern farming has stripped magnesium from soil. Processed foods remove it almost entirely, and chronic stress burns through magnesium faster than most people realize. Every time your stress hormones rise, magnesium is pulled out of cells and excreted through urine. This means that the very lifestyle most people live today, stressful, fast-paced, sleep-deprived, creates a perfect storm for muscle breakdown. Muscle recovery is not just about protein. This is a critical misunderstanding. Protein builds muscle fibers, but magnesium allows that process to happen. Magnesium activates the enzymes responsible for protein synthesis, the process where amino acids are assembled into new muscle tissue. Without adequate magnesium, protein simply cannot be used efficiently. Research has shown that magnesium deficiency reduces muscle protein synthesis even when protein intake is adequate. In other words, you can eat all the protein you want, but without magnesium, your muscles cannot rebuild properly. Inflammation is another silent muscle destroyer, and magnesium plays a central role in controlling it. Chronic low-grade inflammation blocks muscle repair and accelerates muscle loss, especially with aging. Multiple studies have found that low magnesium levels are associated with higher levels of inflammatory markers like C-reactive protein. When magnesium intake is restored, inflammation markers drop and muscle recovery improves. This is not cosmetic inflammation. This is deep cellular inflammation that determines whether muscle tissue heals or deteriorates over time. One of the most shocking connections scientists have uncovered is the link between magnesium and age-related muscle loss, known as sarcopenia. Sarcopenia is not just about weakness. It increases the risk of falls, fractures, loss of independence, and early mortality. Research involving older adults has shown that those with higher magnesium intake have significantly greater muscle mass, grip strength, and physical performance compared to those with low intake. This relationship remains even after adjusting for exercise and protein intake, highlighting magnesium as a hidden determinant of muscle aging. Magnesium also plays a crucial role in energy production inside muscle cells. Muscles run on ATP, the body's energy currency, but ATP is biologically inactive unless it is bound to magnesium. Without magnesium, ATP cannot release energy properly. This means magnesium deficiency creates a state where muscles are technically fueled but functionally exhausted. This explains why low magnesium levels are associated with early fatigue, reduced endurance, and poor exercise tolerance. People often assume they are out of shape, when in reality their muscles are starved for a mineral required to use energy. Sleep and muscle health are deeply intertwined, and magnesium sits at the center of this relationship. Magnesium regulates neurotransmitters that calm the nervous system, including GABA. When magnesium is low, the nervous system remains overactive, even during rest. This prevents deep sleep, the phase where muscle repair peaks. Studies have shown that magnesium supplementation improves sleep efficiency, reduces nighttime awakenings, and increases slow-wave sleep. Better sleep means higher growth hormone release, lower cortisol, and dramatically improved muscle recovery. Even hydration and electrolyte balance depend on magnesium. While sodium and potassium get most of the attention, magnesium is essential for maintaining proper electrical activity across muscle cell membranes. Low magnesium disrupts this balance, increasing the risk of cramps, weakness, and irregular muscle firing. This is why athletes and physically active individuals lose magnesium rapidly through sweat and are at higher risk of deficiency, even if they appear healthy on the surface. The most dangerous aspect of magnesium deficiency is how quietly it develops. Blood tests often fail to detect it because less than 1% of magnesium is stored in the blood. The vast majority lives inside cells and bone. By the time deficiency shows up in lab results, muscles and nerves have often been struggling for years. This is why symptoms like muscle tightness, poor recovery, weakness, and nighttime cramps are often dismissed or misdiagnosed, while the real cause goes unaddressed. Magnesium is not a performance enhancer. It is a biological necessity. It does not force muscles to grow. It allows them to function the way they were designed to. When magnesium is sufficient, muscles contract fully, relax completely, repair efficiently, and respond properly to exercise. When it is missing, muscles exist in a constant state of stress, slowly breaking down from the inside. The science is clear, the data is overwhelming, and the consequences of ignoring magnesium are severe. Muscle health is not just about movement, it is about independence, resilience, and quality of life. Magnesium sits at the center of that equation, quietly determining whether muscles thrive or fail. And the most powerful part of this story is that restoring magnesium is not complicated. It is simply about giving the body what it has been missing and allowing biology to do the rest. Every action you take before bed matters more than most people realize, but when it comes to muscle health, what you do in the final hour before sleep can literally determine whether your muscles rebuild or silently break down while you lie in bed. The body's repair system is incredibly precise, and science shows that the nutrients available in your bloodstream at night are the fuel it relies on. Miss the window and recovery stalls. Feed it right, and your muscles can grow stronger, faster, and more resilient with minimal effort. This is why the simplest daily rituals, tiny actions taken consistently, become the difference between decline and vitality. Imagine this: you've spent the day exercising, eating protein, working hard, but you wake up stiff, sore, or weak. It's not a lack of effort. Research published in the European Journal of Clinical Nutrition shows that muscle protein synthesis is highly sensitive to nutrient timing, especially at night. Your muscles literally become more receptive to amino acids, magnesium, and other critical nutrients during sleep than during any other time of the day. This is a biological opportunity that billions of people are throwing away, unknowingly sabotaging their own strength, longevity, and independence. The most practical, science-backed strategy to seize this repair window is through magnesium-rich foods and supplements. Magnesium is not just a mineral. It is a biological switch that signals muscles to relax, prevents nighttime cramps, and allows protein synthesis to occur efficiently. Without it, the repair process slows down, deep sleep diminishes, and inflammation lingers. Clinical studies have demonstrated that taking magnesium before bed improves sleep efficiency, increases slow-wave sleep, reduces nighttime awakenings, and directly enhances muscle recovery. This is not theory. This is laboratory evidence observed in adults of all ages, from athletes to seniors struggling with muscle loss. Some of the most effective magnesium-rich foods are surprisingly simple: pumpkin seeds, almonds, cashews, and dark leafy greens. Just a tablespoon of pumpkin seeds before bed provides 150 milligrams of magnesium, nearly 40% of the daily recommended intake. Almonds add healthy fats and magnesium, slowing digestion to keep nutrients available to your muscles all night long. These foods do more than just feed your muscles. They calm your nervous system, improve sleep quality, and create the ideal environment for your body to repair itself. Researchers have found that individuals who routinely consume magnesium before bed experience fewer cramps, improved muscle relaxation, and enhanced protein utilization during sleep. Every seed, every nut, every bite becomes a tiny act of muscle preservation. For those who want precision, magnesium supplements such as magnesium glycinate have been extensively studied and shown to be highly absorbable. Doses between 200 to 400 milligrams taken 30 to 60 minutes before bed have been linked to measurable improvements in sleep depth, muscle relaxation, and recovery markers. This isn't a supplement gimmick, it is biology in action. The minerals, the nutrients, and the timing are all orchestrating a nightly symphony of repair inside your body, and magnesium is the conductor. Without it, the symphony falters, muscles remain tense, and repair is incomplete. Consistency is critical. The body thrives on predictable patterns, and repeated nightly support creates cumulative effects. A single night of magnesium before bed might help slightly, but repeated use over weeks has been shown to improve muscle strength, reduce nighttime cramps, enhance recovery after exercise, and support the maintenance of lean mass. Studies on older adults demonstrate that those who combine magnesium intake with evening nutrition experience slower rates of age-related muscle loss compared to those who do not. This is a powerful insight. You are not powerless against muscle decline. Small, intentional nightly actions stack over time, creating profound differences in strength, mobility, and quality of life. Hydration also plays a role. Electrolytes such as magnesium, potassium, and calcium are critical for muscle function, and taking them before bed ensures that muscles remain hydrated, contract and relax efficiently, and avoid fatigue during the night. Research in sports medicine has shown that magnesium and potassium before sleep reduce cramping and improve performance metrics the following day. This is not just for athletes. Even moderate daily movement relies on these nutrients to maintain healthy muscle contraction and relaxation cycles. Missing this window means your body struggles silently, your muscles accumulate tension, and soreness lingers longer than necessary. The timing is just as important as the nutrients themselves. Studies in chrononutrition, the science of eating according to biological rhythms, indicate that protein and magnesium consumed in the evening are more efficiently directed toward muscle repair than the same nutrients consumed earlier in the day. This is because the body shifts into a repair-oriented state during sleep, directing blood flow, hormonal signaling, and amino acid utilization toward tissue recovery. Evening nutrition, particularly magnesium and protein, is not a suggestion. It is a strategic, science-backed intervention that determines the effectiveness of the body's nightly rebuilding process. Nighttime rituals also shape long-term muscle resilience. Establishing a consistent pre-bed routine, such as a small handful of magnesium-rich seeds or a light magnesium supplement, signals to the nervous system that it is time to relax, muscles to let go of tension, and the body to enter deep restorative sleep. Neurologists and sleep researchers confirm that this ritual lowers sympathetic nervous system activity, reduces nighttime cortisol, and increases growth hormone release, creating optimal conditions for muscle repair. Over time, these habits create a protective effect, reducing age-related muscle loss, improving strength, and enhancing recovery from daily activity. What is extraordinary about this approach is its simplicity. No complicated exercise, no expensive equipment, no extreme diets, just small, intentional nightly choices that feed the body what it needs when it needs it most. Every evening, as you prepare for sleep, your muscles are waiting, your cells are ready, and your repair systems are primed. Providing magnesium and protein in this critical window allows biology to do what it has always done, but has been held back from doing by modern lifestyle, stress, and nutrient depletion. The difference between taking action and ignoring this window is the difference between declining strength and sustained vitality. Science, research, and lived experience converge on one undeniable fact. The last hour before bed is the most powerful hour for muscle repair. Providing your body with magnesium-rich foods or supplements consistently transforms this hour from passive rest into active regeneration. You are not merely sleeping. You are giving your muscles the fuel, relaxation, and nutrients they need to rebuild, strengthen, and prepare for the challenges of tomorrow. Night after night, this practice compounds, muscles recover more fully, tension diminishes, and strength is maintained long into adulthood. This is the overlooked secret of muscle health: timing, consistency, and nutrients, working in harmony with your body's natural repair mechanisms. By acting intentionally, every bite, every seed, every supplement taken before bed becomes a statement. Your body matters, your muscles matter, and you are choosing repair, resilience, and vitality over silent decline. Science backs it, research proves it, and your body is waiting tonight as it waits every night for you to give it what it needs to thrive. If you found this helpful, make sure to like, subscribe, and take care of your health, because it's the most valuable thing you have.